Hi, I'm Terri Vinson, Cosmetic Chemist, founder and formulator of Synergie Skin and author of Skinformation. One of the most common areas of concern for all our customers, even adults, but mainly adolescents, is the problem of acne, and it is incredibly common. It really affects self-esteem, and I thought we'd have a real deep dive today into exactly what acne is. Acne is characterised by, I call it the perfect storm of factors in the skin. So the first thing you've got is during adolescence or during times of unnatural hormonal activity, when the hormones are kind of establishing themselves, they haven't quite got there yet, you start to produce excess oil. There's an oil gland sitting in our follicle, and that produces oil into the follicle. So the oil's sitting there, it's sebum. Then you've also got, when you're young, an excess production of new skin cells. So our skin cells, they normally turn around about every 30 days. Somebody old like me is probably about 50 days, but young people can be even, under 20 days. So they've got this massively high turnover of skin cells. So you've got the bacteria, you've got heaps of cells, you've got heaps of oil, and it's party time for those bacteria. So what they do is they feed on the oil, they feed on the dead skin cells, and they produce these inflammatory chemicals which actually cause that redness and inflammation that's commonly associated with zits. So that's basically how a pimple is born. So acne is normally categorized into maybe 4 areas. So you've got your mild acne, moderate acne, severe, and very severe. So let's go through. Stage 1 or mild acne is basically called comedonal acne, and that a comedone is a blackhead or a whitehead. A blackhead is an open comedone, and it's black because the air or the oxygen has oxidized that little bit of oil in the pore, and that's become a blackhead. A closed comedone is when there's no air getting to that oil, and it's a whitehead. It's pretty mild, there's no redness, there's no pain, there's no inflammation. This is normally the starting point of acne, and most adolescents suffer from this type of acne. Then we get into moderate acne, and that's when we have what's called papules and pustules. A papule is a round red pimple. It's usually called a blind pimple because it hasn't got a white pussy area in the middle of it, and it's usually quite red and it's inflamed. So it's the start of the inflammation process of acne. So that's a papule. A pustule, as the name suggests, pus, has got a little white head in it. So they're like inflamed red pimples with a little white spot in them. It can still be considered moderate acne if there's not too many of them. So then we get into more severe acne. And that's when we've got lots of papules and pustules. It's usually seriously affecting self-esteem at this point. These can be painful. You absolutely do not touch them, you do not press them, you do not pop them, and it's becoming a little more severe. You can actually scar at this level of acne, so it's best to really see a dermatologist when you have severe acne, and that's lots of papules and pustules. Then you get to stage 4, which is really very severe acne, and that's your cystic acne. And that's when you have cysts and nodules, and that's basically when the infection or the inflammation from the bacteria and the dead skin and the pus have actually gone deeper into the skin. So at this point it's fairly superficial, there's definitely inflammation there, but when the inflammation gets into the dermis and it basically infects the deeper layer of the skin, you have these bumps. They can be hard lumps or they can be softer lumps, which are the cysts, and they're very large. They can be up to 1 centimetre in diameter. They're very painful, they're very inflamed, and this is absolute red flags for scarring. And this is when you absolutely need treatment that is beyond basic topicals. So I would say for grade 1, which is your mild acne, to your moderate acne, you can probably get by with just topical, but once you get to your more severe acne where you've got lots of papules and pustules and obviously cysts and nodules, that's when you really need extra help. So when you believe you have more severe acne, that's when you really need to consult a skin specialist or a dermatologist. Now, often a doctor will prescribe for you, it can be antibiotics, it can be Roaccutane, which is oral vitamin A, or it can be topical vitamin A, which is prescription based. Now, all of these require a prescription by the doctor, and all of these have a profound effect on the skin. So what Roaccutane does, and also topical isotretinoin, is it basically shuts down the oil gland. When you take it orally, it shuts down almost every oil gland in the body. So our body now lacks its own natural sebum and lubrication. So that can have some side effects, but quite honestly, the side effects probably aren't as bad as the long debilitating effects of scarring. So the side effects of oral vitamin A or Roaccutane, apart from the fact that you can never take it when you're pregnant because it is toxic to the developing fetus, but also it can cause dry mouth, dry lips, dry eyes, dry skin, and there can be some side effects with mood. So you need to be aware of that. Discuss that with your physician. In terms of topical prescription vitamin A, that can have some side effects and you do need to ease into it. It does shut down the natural ceramide manufacturing parts of our skin, so we produce less of our own natural lubricants, as well as shutting down the oil glands, so you do have that flakiness and dryness. So you probably need to sort of ease up your use of topical vitamin A, and be aware that you will have flaking, particularly around the nose and the lips. But if you are prone to scarring, it is probably a really, really good option for you. The other thing you need to consider if you're taking oral or topical prescription vitamin A is that can upset the natural microbiome, and our skin is designed to have the right amount of oil, the right pH of about 5.6, the right amount of bacteria, good and bad, mainly good, a little bit of bad. When that barrier is upset with flaky skin and dryness, you will need to make sure that you address the microbiome. Take your pre and probiotics orally, but also apply them topically, as well as applying a really good emollient. And yes, you can have dry skin with acne. Dry skin and acne are often two separate conditions. So you need to treat your skin with care and be very gentle when you're on oral and topical vitamin A, but it is an excellent choice if you have severe to very severe acne and you need to have medical intervention. In terms of treating an acne condition with over-the-counter topical ingredients and cosmeceuticals, I have got a few favourites. There's some very specific ones that work specifically on the oil gland, a lot of botanicals. But in terms of my general favourites, it would be vitamin A, the retinoid family, vitamin B3 niacinamide, your alpha hydroxy acids, which is lactic, malic, mandelic acid, and beta hydroxy salicylic, and I'll go through each of those in turn. So in terms of vitamin A, we've talked about prescription retinoids. So if you imagine the retinoids are a big umbrella, you've got all types of vitamin A under them. Prescription is isotretinoin, but you've also got your non-prescription forms, which is your retinol, which is one of my favourites, hydroxypinacolone retinoate, HPR, which is, in my opinion, the next best thing to prescription retinoids. The best vitamin A's for acneic skin, in my opinion, over the counter or cosmeceutical, is retinol and hydroxypinacolone retinoate. If you have highly sensitive skin, I would recommend an encapsulated retinol, and that has a gentler delivery that will reduce excess sebum produced by the oil gland. That's how vitamin A works. So apart from reducing oil flow, which is a problem with acne, it also regulates the rate of new cell production. There is an excess shedding of skin cells in young people or people with acne-prone skin. So vitamin A is like the great regulator of the skin. When things are happening too quickly or too slowly, vitamin A comes along and regulates it. So if you're shedding too much, vitamin A will slow that process down. It also can reduce the inflammation associated with acne, and it can also help with collagen production. And if you've got scarring, scarring is basically the production of abnormal collagen. It will help to normalise that process as well. Also, if you've got acne scarring, which is quite common, especially for those with darker skin tones, it will help to reduce the scarring or the hyperpigmentation that's associated with acne. So vitamin A, everybody needs it, except if you're pregnant and lactating for the control of acne. Niacinamide, oh my gosh, this is my favourite ingredient for everything. It is the multitasker, but it's also great for acne. In fact, 5% niacinamide has been shown to be as effective as topical antibiotics in managing the inflammation associated with acne. Pretty cool, huh? It's an incredible anti-inflammatory, and as we know, inflammation is the root cause of almost every negative skin condition, and particularly acne. So it reduces the inflammation. It also repairs the barrier, and when we have acne, our barrier is in a state of disrepair. We've got pustules, papules, blackheads. The barrier is broken. It will help to repair that. It will also help with collagen. It will also help with the pigmentation, and it also helps with ceramide production. Now, our skin can be dry and flaky with acne. It may be oily in the follicle or the pore, but around that area it can still be dry. So you need your ceramides, and vitamin B is amazing at helping ceramide production. So this is a fantastic ingredient, and particularly if you have acne, A and B are must-haves. Then we get onto our acids. Now, in particular, alpha hydroxys, that's used for so many skin conditions, but remember when we've got the high turnover of skin cells, we've often got the skin cells that are basically still stuck on the surface. It gives that dull, sort of congested look to the skin. We need to lift those off and encourage those to come off. Vitamin A is helping it, but the alpha hydroxy acids are basically like a glue dissolver, and they dissolve the glue between the dead epidermal cells or the dead corneocytes, so they slough off and you've got lovely fresh skin underneath. The other thing is beta hydroxy acids are excellent for congested pores, and acne is basically oil and dead skin cells clogging the pore. So what we need to do is we need to get into that pore gently and kind of pull out all the muck inside. Beta hydroxy acids or salicylic acid is fantastic at that, because it loves oil. It just has such an affinity. It's called a lipophilic acid. So it dries into that pore, sucks out the oil, gives it a little bottle brush, pulls it out, and voila, you are decongested. So salicylic peels are great, but even if you have a mild salicylic acid topical, that's highly recommended for acne. That'll help to clear those blocked pores. So A, B, beta hydroxy acids, alpha hydroxy acids are my 4 favourite ingredients for managing acne. So I've always got to give you Terri's tips, and I've got some things to avoid when you have acne. And there's a few things that I personally would not recommend for acne sufferers. The first thing is a bit controversial. I don't love benzoyl peroxide. Peroxide basically oxidizes things. That's why it's called peroxide. So it's the opposite of antioxidants. I don't think it's the best thing for the cells. And if you've ever seen a pillowcase after using benzoyl peroxide in your skin with acne, if it does that to your pillowcase, not really happy with what it's doing to your face. What it is doing, however, it's only addressing one part of the acne equation. It is blasting those C. acne bacteria. It's not addressing the inflammation, it's not addressing the overproduction of skin cells, it's not addressing the oil production. So it's kind of just a little band-aid effect. So not my favourite ingredient, and I'm probably being a bit controversial, but I'd much rather use AHAs, BHAs, niacinamide and retinoids. The other thing I would avoid is overly exfoliating. I find a lot of people want to get rid of those zits, and if there's a whitehead, they scrub like crazy, particularly exfoliants with very rough particles, a lot of plant-based particles, walnut husks, apricot kernel husks. They are like little shards of glass on your skin. And those papules or pustules, they are very inflamed. There's the beginning of an infection there from your C. acne bacteria. You do not want to be inflaming those papules or pustules. So be very, very gentle. You're much better off using AHAs and BHAs than rubbing them. I also wouldn't wash excessively. A lot of people want to wash their face 4 or 5 times a day. The best time to wash your face is when you feel it's at its dirtiest, usually when you come home from work or school or uni, that's a great time to gently wash your face, and usually twice a day. I'd also avoid comedogenic oils, so your coconut oil, peach oil, soybean oil, cocoa butter. There's a lot of really comedogenic oils, and what comedogenic means makes comedones, and comedones are blockages in your pores. So it's a fancy word for things that make blackheads and whiteheads, and they can become papules and pustules, and they can become cysts and nodules. So be aware, avoid comedogenic oils if you have skin that is prone to congestion. The other thing is absolutely avoid home needling devices. If you have an active papule or pustule, anything that's a red pimple, you should avoid that like the plague, because you are going to be puncturing those papules and pustules and possibly getting more infection into them. So you should not be home needling, and certainly not clinical needling. The other thing I'd like to say is, instead of using makeup which may contain comedogenic oils, definitely opt for mineral makeup with high levels of zinc oxide, because zinc oxide is, apart from being a natural UVA, UVB protector, it is also a natural anti-inflammatory. Zinc oxide is the basis for calamine lotion. It is a beautiful anti-inflammatory. And anecdotally, I've noticed a lot of girls and guys that opt for minerals, either mineral sunscreen or mineral makeup, and do nothing else in their skincare routine. We often see that their inflammation reduces with their acne. They've possibly got less lesions, acne lesions, and their skin does a lot better. So really opt for a high quality mineral makeup with high levels of zinc oxide. Now, I'm going to touch on dimethicone, because that's really, really controversial. Technically, dimethicone is not comedogenic. In other words, it does not clog your pores. But some types of dimethicones actually put a layer on your skin, and it prevents what's on top of the skin from coming off. So say, for example, you've come home, you've been touching a lot of surfaces in your face, and your face isn't clean, and you put a moisturiser on or a product or makeup on with high levels of dimethicone. Basically, that's putting a layer on your skin, and you're trapping all that dirt that you've got on your face into your face, and that can cause further problems with your acne. So even though dimethicone doesn't cause acne breakouts, we're finding people who use products with quite a bit of dimethicone in them find they get more breakouts. So if you are using dimethicone-based products, I do absolutely stress you make sure your face is clean and hygienically washed before you apply your dimethicone products. When you have acne, you often seek clinical treatments. Even if you don't go down the dermatologist route or the medical professional route, you can still go to a wonderful skin clinician and have some great treatments for your acne. So if you've got really mild acne, comedonal acne, blackheads and whiteheads, microdermabrasion is a great option. It can gently but very professionally remove what's clogging the pores, and your skin is clearer and cleaner. Generally though, if you're prone to blackheads and whiteheads at a certain age, they will come back in a few weeks, but it's a great option. If you've got a little bit more severe acne and it's becoming papular or pustular, I would recommend having some skin peels. You can have various strengths of peels. You can have salicylic on its own. You can have lactic and salicylic mixed together. That's a lovely combination, because the salicylic loves the oil, and that usually goes on first and pulls out the oil and debris from the follicle, and then the lactic layered over the top disconnects the dead skin cells that are sitting there anyway, and also really helps with hydration, and also helps with the pigmentation on the surface. So that's a lovely combo. Another really good peel is the Jesna peel. There's many types. There's modified Jesnas, but basically a Jesna is a common formula, and sometimes you can add other ingredients like kojic acid, mandelic acid to it, or pyruvic to help with the acne, but Jesnas are a great option. You can also control a Jesna by adding certain layers, so you can have a single layer if you've got more sensitive skin, or multiple layers if your skin is a bit more robust, and that really helps with the papules and pustules, and also there's the pigmentation. So peels are a good option. Make sure you go to a really good clinician or a medical professional who knows what they're doing in the peel space, because you can cause skin damage if you peel too aggressively or you don't choose the right peel for the right skin type. Another really great treatment, and I think it's underestimated, is blue light therapy. Now we know that blue light directly targets the deeper layers of the skin where the acne bacteria reside, and C. acne bacteria release substances called porphyrins. And blue light directly interacts with these porphyrins and basically neutralises the negative impact of the acne bacteria. Blue light therapy, you can get some great LED lights even online. I would recommend you use it during the day because it wakes you up. You should not be putting your eyes in blue light at night because you won't get to sleep. But during the day you can do it. And blue light therapy would be fantastic as an adjunct to a clinical treatment. High level blue light therapy, or buying a little blue light online and going under that, they can all be really, really helpful in controlling the acne condition. One of the things that gives me the greatest satisfaction being a cosmetic chemist and being able to make products is when I have an impact on somebody with really serious acne. And I'll get a Facebook message or an Instagram message, and it makes me really happy that somebody's going out again, becoming social, getting their confidence back because they've addressed their acne condition. So that makes me really happy. And I also have been asked so many times, Terri, can I just get rid of it? And the straight answer is no. You actually can't just get rid of acne. It's a chronic condition. It's always related to basically hormones. When the hormones are in a state of flux, usually in adolescence, that's when your body reacts by producing too much oil, overproducing skin cells, and this is when the acne condition begins. So it's not until we reach what we call hormonal burnout, where the hormones regulate themselves and we're in a state of just ease with our hormonal levels. Usually can occur anywhere between the age of late teens to our mid-20s. And you'll notice that you may have had acne and over the next few weeks it goes and it's gone. But that was your hormones doing the work. So what we can do with topicals, with cosmeceuticals, with medical treatments like Roaccutane and isotretinoin and clinical treatments, they are controlling acne. We're not actually eradicating it. So we need to have a realistic expectation when we embark on treating our acne and realise that it's all happening from within. So there are so many other things we can do as well. It's really, really important to hydrate, drink plenty of water, absolutely no sugar. Sugar is the best friend to acne internally, so we should cut out all sugar. We should reduce dairy intake because there are some factors in dairy that can exacerbate acne, but also make sure you maintain your calcium levels, particularly when you're young. Eat really good oily fish or good sources of omega fatty acids, high omega-3s, and also make sure that you have antioxidants. So in terms of your nutrition, maintain a really good nutritional balance, but make sure that you are realistic and realise that this too will pass and you will reach hormonal burnout, but in the meantime, it can be controlled. So I hope you've got a little bit out of our discussion today about acne, the factors involved in acne and the potential treatments. I've really enjoyed explaining it. Education is paramount to me, so hopefully you've got something out of it. There's going to be heaps more content to come about various skin conditions, so I'm really excited for you to follow me in my journey and to help educate everybody to empower you guys to make the right choices about your skin.